Hello, I'm Whitney Huppert. I am doing an overview of borderline personality disorder. The case I chose is case 15, which is Robin's case. The overview of BPD, or borderline personality disorder, as one of the most common personality disorders that we see in a clinical setting, according to our course textbook, Barlow et al. 2023. People who are diagnosed with this disorder often have unstable moods, relationships, along with poor self-image. According to the DSM-5 for borderline personality disorder, recurrent suicidal behavior is evident in the individual, which can include acts of harm to oneself, threats of suicide, and/or self-mutilating behavior. The most common treatment for BPD is cognitive behavioral therapy. Of the many different approaches to CBT, dialectical behavior therapy is the most common and effective. According to Barlow et al. 2023, quote, DBT involves helping people cope with the stressors that seem to trigger suicidal behaviors and other maladaptive responses. Priority in treatment is first given to those behaviors that may result in harm, then those that interfere with therapy, and finally, those that interfere with the patient's quality of life. Barlow et al. 2023, page 468, unquote. This type of therapy is looking to help the patient trust themselves and no longer need the validation of others throughout the day. In the case of Robin, she showed the characteristics of BPD to a T. As the case described, she was a victim of an abusive childhood that led to her not developing effective and appropriate interpersonal relationships with those around her, including her husband. Brown and Barlow, 2017. She rode the roller coaster of emotions and relationships, as the case study indicated, which made an unstable base for relationships as well as her moods and emotional needs. The relationship became strained when Robin began to attempt suicide with her husband. Her clinical team started to have Robin attend DBT sessions to help her with her disorder. After a little over a year of therapy, Robin seemed to be on the up until her husband filed a divorce for no longer being able to deal with Robin's mood swings and her disorder. Shortly after that, she made her last and most successful attempt on her life. When it comes to the thinking critically questions, there was 4 of them. The first one is, what factors do you think contribute to the finding that BPD is much more common in women than in men? I believe women are more likely to internalize the different emotions that go along with borderline personality disorder. According to an article, Gender Differences in Borderline Personality Disorder, a Narrative Review, quote, we suggest that by borderline personality disorder in women often experience internalizing disorders and comorbidity with BPD, while men often report externalizing their disorders. Internalizing disorders reflect inwardly directed distress. Thus, patients are more likely to meet the criteria for depression, anxiety, eating disorders, and somatoform disorders, unquote. Bazzalo et al. 2024. The internalization of emotions can lead to more attempts on one's life and more unstable actions, which can include different attempts on the individual's life. Women also tend to be more emotional than men, in my experience. You also hear men typically call us crazy, insane, and we're just unstable with our moods because we do experience different moods depending on our different phases of our follicular cycle as well. Women are more commonly to have a history of abuse than men, and these factors are common causes of borderline personality disorder, as the personality of the individual is changed through different experiences they may have in life, which can occur in childhood, early adulthood, and later in life. In the case of Robin, she was very abused by her father while she was a child, both sexually and physically, according to Brown and Barlow, 2017. The next question, BPD is associated with an elevated suicide rate. What reasons do you believe account for the surprisingly high incidence of parasuicidal behaviors in these persons? And what do you think are the best ways to respond to a person who displays suicidal gestures? Since the suicide rate among people with BPD is much higher than other disorders, I believe that this happens because of the instability of mood as well as the inability of the individual to have a positive self-image or positive relationships. I believe that the best way to respond to those who are displaying suicidal gestures is to listen and seek professional help when the individual is in a safe and secure environment. Cognitive behavioral therapy is a great way to extend the ongoing care of a professional to help the individual cope with daily stressors. Cognitive CBT can be as frequent as a session every day online, or it can be weekly or monthly, as well as medication factors that can help with mood stabilizing. SSRIs are a great way to help with that, as well as treating different anxiety that happens with the different stressors people may have. The third question is, what similarities do you see in the features and risk factors of BPD and the features and risk factors of dissociative identity disorder, or DID? Do you believe the similarities of these disorders are more prominent than their differences? Why or why not? Both BPD and DID have similar connections with the instability of moods, emotional regulation, and unstable relationship connections. The ways of coping with either disorder is different for the different disorders and the severity at which an individual presents. While these symptoms are similar, the outcomes are different. The different treatment courses set for those disorders and the approach of the therapy that is offered is the best way to help treat the individual. In BPD, the therapy focuses on emotional regulation and coping with the stressors that make the disorder life-consuming. In DID, the therapy sessions focus on the different personalities that help the individual cope with the stressors in their life, as well as learn different healthy ways to cope with each stressor. While the similarities in these disorders are very prominent, I believe that the differences make the cases important. This is because multiple personalities in DID can have different effects based on the personality history of each individual personality. I believe that DID is more complex in that sense and needs to have a more person-centered and thorough case study of each individual to find the correct and effective therapy approach. People often think that these two disorders are very similarly linked, which I believe they are. According to the DSM-5, they follow a lot of the same path. The difference in the two is the different ways that the people cope. When it comes to BPD, people have risk factors of suicide and suicidal ideation. In DID, they may have those, but that is dependent on the different personalities that do come forward and how the person copes with their disorder. And the final question is, do you think Robin's suicide could have been prevented? If so, how? I honestly do not believe that Robin's suicide could have been prevented, as she was following through with her treatment schedule. Things started to work out for her. She was following through with the tasks of the evening, and she eventually succumbed to the need to end her life. In the case study, toward the end of her life, her husband wanted to file for divorce and did, which caused another low in her treatment schedule. With that, she ended up with a roommate and started to go on the up again, but still having these suicidal thoughts and ideation. She was supposed to be watching a movie with her roommate the night that she took her life. She did. She communicated with her therapist, and she promised her therapist that she would be at the therapy session the next day. Her roommate ended up finding Robin in her bed, and she succumbed to drinking alcohol and taking prescription medications, which ended her life. In conclusion, despite numerous challenges, Robin continued to show remarkable resilience by persisting through the lows of her situation. Even during the high points of her disorder, she demonstrated an unwavering determination to keep going. I was surprised when she succeeded in ending her life, and that she did when her roommate was home. Other attempts were more theatrical in nature, and her therapist did her best. Thank you.